Time now for a look at your health. It can be devastating to people's self-esteem, and tonight we're focusing on hair loss, not just in men, but also women, the causes, the treatments, and the foods that could help or hurt. Joining us now, like he does every Tuesday, Dr. Mitchel Goldman from UCSD. Thank you for being here.
Good to be here.
We always hear that hair loss is genetic, nothing you can do, but you say there's a lot of other potential causes.
There are. The potential causes are mostly disease, not eating right. So there are a few diseases that can cause it, such as hyperthyroidism, such as a lot of stress-related diseases. Of course, if you're pregnant, if you've been under stress, you usually don't get the hair loss immediately, but the hair loss can occur gradually over time.
But you say if the onset is quickly, that might be a red flag that you have something else going on?
It is. If you notice a lot of hair coming out very quickly and it has not been preceded by a big medical illness, then that's when you should see your doctor, because there's a number of tests that you can do for your thyroid, make sure you're not anemic, make sure you don't have an autoimmune disease that can actually reverse the hair loss.
All right, so what about like the way you treat your hair?
You know, that is important, especially if you over shampoo, if you over dry, if you do a lot of the Brazilian blowouts or ironing your hair, you can actually break it off. And hair, you know, really only grows from the scalp. Once you have the hair, it doesn't grow. So you have to take care of it when you have it.
So let's talk some treatments. Do the supplements really work? What are our options?
You know, supplements will work if you've got a really poor diet. So if you've got a poor diet, if you're not getting enough iron, if you're eating too much sugar or too much fats, that's all a bad thing. But the only supplement that really works is biotin. So make sure you have biotin, make sure you're getting your B vitamins, your vitamin A and C, the antioxidants, and that'll help to promote hair growth.
But do you have to take it in moderation? Because I've also read that if you have too much vitamin A, then that could actually cause it to fall out.
Oh, absolutely. And we see this in people that juice carrots and eat like lots of carrot juice, and they have a carotenoemia, hypervitamin A, and they can lose hair from that as well. So as with almost everything we're doing, everything in moderation. Now, you know, you talked about self-esteem and hair loss. Now, Lauren and I don't have poor self-esteem with our hair loss. Where I see it mostly is women.
Sure.
And it's really an epidemic. There's about 30 million American women with hair loss. And for a beautiful woman to start losing their hair, that can be pretty devastating. And so we do have some treatments. The treatments, of course, are make sure you're getting right vitamins and nutrients. There's also topical things that we can do. Rogain's been around for over 30 years. In my residency, we did the first studies, and it still is tried and true. You can get it almost everywhere. Your doctor may supplement it with some other types of medication, including oral medication that can block the male hormone.
And there's a lot of products coming out, though, that whether to name a few, you hear those Ovation ads on the radio. Aveda has its own line of, are those effective or are those more cosmetic?
No, some of them actually are effective, because you want to make sure you have good scalp health. Now, it's not going to grow back a full head of hair, but make sure your scalp is healthy. The Fido brand, the Aveda brands are good brands to use as far as scalp and hair. And then the last resort is hair transplantation. Now, if you have hair transplants, you don't have to look like a doll's head anymore. We can transplant single hairs, and so no one, absolutely no one would ever know that you had a hair transplant. And that's for men and women. So eat right, take the right supplements. Topical minoxidil still really works. See your doctor if it comes on pretty quickly. And last resort, we even have hair transplantation.
All right, some really good advice. And you know, the women out there, we've been raised, Lauren, you say it's not as traumatic for men, but women are raised that your hair is your crowning glory. So understandably, when they start losing it, it's not easy.